In this next gen NCLEX question, we have a bow tie question to look at. We're given a scenario and we have to determine what potential condition the client has and then determine 2 actions to take as well as 2 parameters that we want to monitor. Let's take a look at our scenario. So the client is 38 weeks pregnant, she's a G1P0, and she's at the obstetrician's office for a routine prenatal visit. She reports having a gush of fluid a few days ago that soaked through her pants, and the client also reports constant abdominal cramping, and on exam, the lower abdomen is soft but tender to palpate. She has an increased strong odor vaginal discharge that's present, and she also reports having difficulty taking a deep breath. In her vital signs, we see that she has an elevated temperature of 101.2, her pulse is elevated at 126, respiratory rate is elevated at 24, and the fetal heart rate is also tachycardic at 180. A normal fetal heart rate pattern is 120 to 160. So in this scenario, I am concerned that this client might be experiencing an infection. We have this strong odored vaginal discharge, which should never be present, right? A strong odor can indicate infection. The client also had this gush of fluid, which could be her membranes or her amniotic sac that is ruptured, and that means that it ruptured several days ago. Her abdomen is also tender to palpate, which could be because of inflammation from infection. And of course, we saw in her vital signs that elevated temperature, respiratory rate, and heart rate, which all indicate a possible infection. So let's keep that in mind as we look at our potential conditions. So we first need to figure out what potential condition this client is experiencing, and then we'll determine the actions to take followed by the parameters to monitor. So keeping all of this in mind, let's take a look at each condition. Chorioamnionitis. So I definitely think that this client could be experiencing chorioamnionitis. Chorioamnionitis is an intrauterine infection. Now notice in risk factors, we see that prolonged rupture of membranes increases the risk for chorioamnionitis, and a rupture over 18 hours is prolonged, which if this client ruptured her membranes a few days ago, she is definitely prolonged rupture of membranes, which just increases this risk further. When that amniotic sac ruptures or those membranes rupture, it allows an area for microorganisms to ascend into that uterus and cause infection. This is going to infect the placenta, it's going to infect the amniotic fluid, it's going to cause tenderness to that abdomen, and this can lead to neonatal and maternal sepsis. Based on all of our findings, I believe that it's chorioamnionitis, but let's take a look at all of our options. The next one is placental abruption. Now, placental abruption occurs when that placenta prematurely separates from that uterus. With this, we can see external bleeding, which this client does not have. She's having some mucousy blood-tinged discharge, which can happen with cervical changes during labor. We can also see internal bleeding. That bleeding gathers behind that placenta, and that's going to cause a rigid board-like abdomen. Now, this client's abdomen was soft, if you remember, and she did have tenderness, but again, this is going to cause an extreme amount of pain. An organ is becoming detached from the body. She does have 7 out of 10 abdominal pain, but that could also be related to the infection. I do not believe that placental abruption is our potential condition. Next, we have urinary tract infection. Now, a UTI can definitely cause some cramping and some abdominal discomfort. However, you would not have a strong vaginal odor present with a UTI, so I do not believe that that's a potential condition for this client. And our last potential condition is amniotic fluid embolism. Now, an AFE is extremely rare, and it occurs when amniotic fluid enters the maternal circulation. This is going to quickly lead to severe hemodynamic instability that needs prompt treatment. Now, this client is hemodynamically stable, right? Her blood pressure is good. She might have a slightly elevated pulse and respiratory rate, but again, that's probably likely from an infection. Now, I know you might be thinking that she was experiencing some difficulty taking in a full breath, but that is normal in pregnancy, especially at the end. During pregnancy, that gravid uterus is taking up space. It pushes up on that diaphragm, so that diaphragm cannot fully compress and push down when those lungs expand. And that makes it difficult to take a full breath as we get further into pregnancy. And looking at the client's vital signs, if you remember, she was 96% on room air, so an AFE is not likely. So I hope we all agree that chorioamnionitis is our potential condition here. Okay, so now we need to look at what actions we want to take. So think of this as a select end. We have to find 2 actions that are the most appropriate actions to help with our chorioamnionitis. So we want to look for actions that have to deal with assessment and treating this chorioamnionitis. Administer IV ampicillin. Yeah, so ampicillin is an antibiotic, and that's going to definitely help us treat this chorioamnionitis, right? It's a bacterial infection, so we need antibiotics. Prepare for a cesarean section. No, so a cesarean section is not necessary. This client can still labor and deliver vaginally unless the mother or fetus start to decompensate. And although that fetal heart rate is tachycardic tachycardic, we're going to give some antibiotics and hopefully maybe some antipyretics to reduce this fever, and that's going to help with that fetal heart rate. Prepare for an abdominal ultrasound. So an abdominal ultrasound can help us assess the placental location. It is not going to help us with assessment of chorioamnionitis. Administer oxygen via a non-rebreather. So again, this is not going to help with our treatment for chorioamnionitis, and this mom's pulse ox is 96%, so we do not need to give oxygen. Obtain a white blood cell count. Yeah, so this is going to help with our assessment, right? We can assess this infection status. So we will obtain a white blood cell count. All right, so when we look at our parameters to monitor, we need to think what assessment findings are going to help us know that our interventions for chorioamnionitis were successful. So fetal heart rate, yes, this is definitely important to monitor. We can see how this fetus is tolerating that intrauterine environment. Now that we have this intrauterine infection, it can definitely affect that fetal heart rate and the fetal well-being. So we need to keep an eye on that. Respiratory rate. So respiratory rate, oxygen saturation, and maternal hemoglobin are all important things that we're going to be monitoring. However, none of these are going to help us see if our interventions have helped for chorioamnionitis. If this client was in respiratory distress, we would definitely be monitoring our respiratory rate, our oxygen saturation. Her hemoglobin is definitely something that would be monitored more if we had a placental abruption or postpartum hemorrhage, but none of these are going to help us with our chorioamnionitis. So our last option here is maternal temperature. We definitely want to watch this, right? We want to make sure that the antibiotics are doing their job and that we are improving her infection status. So for a client with chorioamnionitis, we are going to administer IV ampicillin or an antibiotic. We're going to obtain a white blood cell count, and we're going to be monitoring that fetal heart rate and maternal temperature to determine if our interventions were successful. Let's check our answer. We see that we're correct. Now, if you found this helpful, please join us for our webinars that we host weekly. We go over NCLEX practice questions to help get you successful for your NCLEX exam.